Stay up to date with what's happening in North Central Washington. Go to the NCW Life Community Calendar at ncwlife.com.
Hi, welcome to Life with Lisa Bradshaw. On today's show, we're talking about colon cancer, its screening, and the 80 by 2018 pledge. This story was brought to my attention via social media about a woman named Dawn Eicher. She'll be on the show later today via Skype in Hawaii. But in the studio, we have, right here at home, Dr. Jorgensen. She's a gastroenterologist at Confluence Health. Thanks for being here.
Thanks for having me.
So I wanted to have you on today to speak to the official side of things, being that you're a physician here and this is your specialty. And we'll talk with Dawn later in the show, or I will, about her specific story. And you've read about her story and her young age onset of the disease. But tell us a little bit about what you do and what is involved in your job.
Okay, well, I'm a gastroenterologist, which just means that I take care of people's GI health. We take care of everything from the top to the bottom. And one of the most important things we do is colon cancer screening, and I think that's what you wanted me to talk about today, so I will. And the 80 by 2018 initiative. So first of all, the 80 by 2018 initiative is a joint effort that's going on across the nation. It was started by the American Cancer Society and the National Colorectal Roundtable. And over 1,000 companies and organizations have joined in the efforts. And the goal is to get 80% of eligible adults screened for colon cancer by 2018.
And when you say eligible, what do you mean by eligible?
So currently screening is recommended for all men and women between the ages of 50 and 75. We sometimes lower the ages and extend the ages based on certain criteria, but in general, it's adults between the ages of 50 and 75.
So when you say that there's companies and that are nationwide that are supporting it, do you mean hospitals, clinics, that sort of thing?
You know, a lot of them are hospitals and clinics, but there are also just private companies that have decided that it's important for them to keep their workforce healthy, and they're also encouraging their employees to be screened.
So when I mean, the symptoms aren't, you know, really desirable to discuss, but let's talk about some of the things that someone might notice early on, but think they can ignore, or not be too sure it's connected to a colon cancer risk. So let's talk about those factors.
Sure. So one thing that's really important to remember is that early colon cancer usually doesn't have any symptoms. So even if you're not having symptoms, it's really important to be screened. And I think that's one of the big barriers that there is out there that prevent people from becoming screened, because people are like, well, I'm not having any symptoms, I don't need to be screened. But that's the best time to be screened, because you want to catch things early. So once colon cancer progresses, colon cancer starts as a polyp, and a polyp is just a bump in the colon. And when the bumps are small, they don't cause any symptoms. But as they grow, they basically cause obstruction or blockage of the colon.
And those polyps are what is found in the screening sometimes.
That's right.
Very early onset, and you guys can deal with those. You remedy that. Yeah,
so one of the ways that we can screen for colon cancer is with colonoscopy, and I'll explain that in a minute, but it can detect precancerous lesions to prevent colon cancer. So colon cancer screening is really unique. It's one of the few cancers that you can actually prevent from happening. Most screening programs are aimed at picking up the cancer they're screening for early so that it can be treated, but colon cancer screening is preventable.
It's a preventative measure.
That's right.
So as opposed to a mammogram where they're trying to detect early cancer or breast MRI, that sort of thing. Yeah. So then someone has, so once they've got to the part where perhaps they haven't had screening, and it's a yearly recommendation, or
so there's a bunch of different ways that you can get screened. One is colonoscopy, and colonoscopy is basically a long, thin tube with a camera on the end of it that is put in your colon, and it looks at your entire colon, and if you have polyps, they're removed. If you don't, then you're good to go for actually 10 years. You only have to have it done every 10 years if you don't have polyps. If you have polyps, then usually we have you come back in 3 to 5 years, depending on.
So it's a slow progression.
It is.
Regardless of the type even. Even if it's an aggressive type, it's usually a slow progression.
Yeah, usually, and certainly, you know, cancer's all over the place. Some are very slow growing,
Right.
some are more aggressive. It depends on your genetics and things like that.
But that's why you can push it out so far. So then you get the screening. Say you don't have the screening, or say you start to have symptoms. What do those symptoms usually look like when it's a little later in the process?
Yeah, so some of the symptoms that people can have are bleeding. So if you ever notice blood in your stool, that's definitely something you want to bring up to your physician. If the cancer gets big enough, it can cause blockage, and that can cause pain, bloating. It can cause what we say is decreased caliber of the stool. So sometimes people will have very thin stools. Those are the main things. Sometimes weight loss. That usually means that the cancer has really gotten too far.
Okay.
If you're starting to lose weight.
Well, you read up about Dawn's story, and
did.
she very young onset, but she started having symptoms, and she'll talk more detail about her story.
Yeah.
At 20 years old, and wasn't diagnosed until she was 36. So 16 years of having symptoms off and on. Advocacy, I think, is the thing that I want to focus on as well in this discussion, because when you go to see your doctor and you're dismissed because you're 20, but you know something's wrong. For me, when I had Hodgkin's, I felt a lump. I went to the doctor. Within 2 days, I knew what I had, and I knew how to treat it.
Right.
So I can't imagine having walked around with a lump on my neck for 16 years and not know why it's there, or, you know, because we know our bodies. She knew her body, and something was wrong. So what's your advice to patients in that situation where, you know, there is something wrong and they're not sure what it is, and how do they go about talking about that with their physician?
Yeah, so I mean, I think it's good to be persistent, but if you're not getting the answer that you want with your physician, you should always seek a second opinion.
Yeah, and it's one of the things that that I wanted to get your opinion about. She talked about how she used WebMD, you know, and I'm sure you get, the internet's changed things, right?
Yeah.
So a lot of people come in with self-diagnosis. So
Sure.
What's your advice for people in doing their own research? I mean, to know, to get good information, but how much is too much information?
So I really like it when my patients come in educated. You know, if they've read a little bit on the internet, they usually ask better questions and have a better understanding of what I'm going to tell them. So it's helpful, usually. And there are reputable internet sources, and there are ones that are less reputable. WebMD is a great resource for patients, so I think that's fine.
One of the things that I was thinking about when preparing for the show, when I went through chemo for Hodgkin's disease, there was a blue card, and on the front of the blue card, I didn't go through treatment here, I went through it in California, and there was a blue card, and on the front of the blue card was the normal things that could happen, just expected. That's not going to be comfortable. It might even be painful, but this is part of the deal going through chemotherapy. And on the back of the card were the things that, if these things are happening, you need to see your physician or go to the emergency room, depending on which side of the card they were on. I never looked at the back of the card. I let my husband and my mom look at the back of the card, and then I communicated if any of those things, nothing ever happened to me from the back of the card. But my point is that I tried to really be careful about not having too much information, because I was pretty sure I would accidentally will myself into that.
Into having those things.
So
yeah.
I think that I can relate to her, to Dawn, who will be on later to talk about her story, about how you just kind of get to feeling like it's a little overwhelming. And so she had to advocate for herself. And so a second opinion, yes, that's great advice as well. And so when you have patients come in, what is your advice for the question and answer part of things? Because I've talked to people from an advocacy point of view about writing down your questions and having that organized thought, because the time is limited that you have to spend with each patient. So what is your advice for someone who's coming in, who is in the midst of the illness even, for coming in and getting the most efficient appointment possible?
Yeah, it's definitely good to write down your questions ahead of time, because guaranteed when you're sitting there at your appointment, you're going to forget half of the things that you wanted to ask. It's also a really good idea to bring a friend or a spouse or some other person with you to maybe take notes or to remind you of things that you wanted to ask, and to help you remember what you've been told.
Well, I appreciate all the information you're giving. I am eager to talk with Dawn about her specific story, but I'm also eager to educate people right here in our community. So the goal is age 50 or above to get a screening, get your first screening at age 50.
Right.
And if you're having symptoms, certainly
Definitely sooner.
Definitely sooner. And then to, be able to communicate with your doctor about those things.
Yeah. And can I put in one other plug?
Sure.
So we've talked about colonoscopy, but it's certainly not the only way to get screened. And I think the fear of colonoscopy is a big barrier to why patients aren't getting screened. Currently, only about 2/3 of eligible patients are screened, which means there are 23 million Americans that have not gotten screened.
Right.
So the other tool that we're using at Confluence Health, and it's used across the nation, is called FIT testing. It stands for fecal immunochemical testing, and it's really simple. It's a test that you can do in the privacy of your own home. You just collect a little tiny bit of stool, you put it in a little container, and you mail it to the lab. Now the downside is you have to do it every year. It's not quite as accurate, sensitive as colonoscopy, so it does need to be done every year. But it's cheap, it's safe, you don't have to take off work, you don't have to do a prep. So if you're opposed to having a colonoscopy, it's definitely a good alternative.
It's a FIT test.
Yeah, it's called FIT test.
Okay, that's good information. I've never even heard of that before.
And you can self-refer for it. You can just go to any, Confluence lab in Wenatchee and say, I want a FIT test, and they'll give you one.
Is there an age restriction for that?
That's a good question.
That's
I think they
probably,
that's an insurance issue. So I think insurance would probably only cover it if you're between that 50 and 75 years.
Unless you have a risk factor or something.
Right.
Okay. Well, thank you for being here.
Yeah,
I
thanks
really
for having
appreciate
me.
the information. And when we come back, we'll talk with Dawn Eicher about her diagnosis at 36. She had symptoms for 16 years before she was diagnosed. I found her story on Facebook, and I'm looking forward to talking to her in Hawaii. Thanks again.
Thank you.
Have a fun video you'd like to see featured on NCW Life? Email us at newsphotos@ncwlife.com.
Hi, we're back. We finished talking with Dr. Jorgensen of Confluence Health, and now via Skype we are talking with Dawn Eicher, all the way from sunny Hawaii. We could use some sunshine around here. Thanks for being here. I found your story. It was sent to me through Facebook. An extraordinary story of advocacy, which I really want to support on this show. So thanks for being here. And tell us a little bit about starting when you were 20 years old. I let people know that you were having symptoms for 16 years before diagnosis.
I was. I was my early 20s. I was 21 years old. And I started noticing that I had bright red blood when I had bowel movements. And at first it didn't really concern me that much. I'd always kind of had an irregular bowel movement, gastrointestinal problem, but I decided to see the doctor, and she agreed bright red blood is never a good sign. So she actually ordered an endoscopy and a colonoscopy, and the insurance company denied it. They actually said that I was too young for a colonoscopy. So they allowed me to have the endoscopy, but they did not let the colonoscopy go through. So
just for people watching, what's the difference between the two? We talked about colonoscopies with Dr. Jorgensen. What would be the endoscopy? That's when they go the other direction. Is that right?
Correct. So they do an upper GI study versus a lower GI study. So they allowed the upper because they would say someone in my age group might have, gastroreflex, or they might have some other upper GI issues, but it's really uncommon, especially back then, for someone younger to have a lower intestinal problem. So, it would come on and off. It went away for a while, and then it would come back, and I went to various doctors for many years. So every couple of years it would come back.
Oh, a couple years. Okay.
Yeah, every couple of years it would come back, and it would come back with a vengeance. And, it would worry me enough to go to the doctor. And every time I went to, anything from a regular primary care doctor, with an HMO, to a private practice doctor that was rated one of the best in San Diego. So, they all missed it. None of them ever gave me a rectal exam. No one ever tried to do a little flexible sigmoidoscopy to see what was going on. Everyone just assumed it was a fissure or hemorrhoids and sent me on my way.
So the first doctor you saw sounds like they were going to take steps to get the procedure that you needed or the test that you needed. Your insurance denied it. So you feel, based on your description, that there are other things that could have been done to detect, or at least to validate the need for further testing that the insurance may have agreed to.
Correct. They never really got to the bottom of the symptoms. And that's what I think I'm advocating more most, is that people know when something's wrong. And I knew something was wrong. But if your doctor isn't alarmed by it and they're not the ones ordering the tests, it's really difficult, because you don't want to seem like a hypochondriac,
Right.
coming back saying, I WebMD'd myself and it says colon cancer, which is what I ended up doing at the end. I was 35 and pregnant with my son. And I had a lot of blood and a lot of pain and a lot of, which is, some of it is normal during pregnancy. Sometimes you have hemorrhoids and things like that, but I just knew something was wrong. And I kept bringing up to my, OBGYN, and she kept saying, oh, don't worry about it. It's fine. It's normal. She should have been able to do a rectal exam and find the tumor. I mean, it was so large at that point, and so low that it should have been, you could actually almost feel it through my vaginal exams. So
you went through this for those 16 years of having intermittent symptoms and going to the doctor, advocating for yourself. One of the things that I shared with Dr. Jorgensen earlier in the show is, as I had shared with you, that I had had Hodgkin's years ago and I had this lump on my neck, and I went to the doctor and they knew what it was and how to treat it. It's very treatable cancer, very known cancer. I cannot imagine going through what you went through, because to me, what you were going through is no different than having a lump that doesn't belong on your neck. You know something's wrong and you don't know how to fix it. So when people are watching today, what is your advice? In hindsight, obviously you advocated for yourself. Is there anything you would have done differently up to the point of when you were finally diagnosed?
I think that I would have said, you know what, I understand that you believe it might be this. Let's get a test to make sure. So diagnostic testing, especially whenever there's blood or something that just doesn't feel right, or you have extreme fatigue and you have stomach pains. I mean, there's a lot of different symptoms, but the main one, it seems like in young people, that I hear over and over is blood. So if there's ever blood, don't ever let them tell you it's probably hemorrhoids, or it's probably a fissure, or it's probably this or probably that. Make sure that you push for the diagnostic tests, because I think that is what will save lives. Is a simple sigmoidoscopy they can do. The majority of the younger people getting cancer, it seems to be more sigmoid, colon, and rectum. So that has actually quadrupled since 1994 in people under 50. Wow. So that tends to be where the primary tumors are located. And then most genetic ones are going to be in the colon. But there are some people, I know people that have been in their early 20s, to mid 20s, that have been diagnosed stage 4 and had colon cancer. So without a colonoscopy, they will not find it. So I would say, try to push for the simpler tests first that can be done in the office, which is a sigmoidoscopy or a take-home, like a Cologuard or a FIT test. The fecal,
she mentioned a FIT test earlier in the show.
So they can do that to see if there is blood present, and then usually they can push to get a colonoscopy approved through insurance.
They have to build their case,
just advocating. Yeah, you have to just accept some responsibility as a patient for pushing for more, because I think everyone would like to hear, okay, good, the doctor told me I was fine.
Right.
I'm going to go home and forget about this, because no one wants to have that done. But I'll tell you, it's a lot less, invasive than cancer and cancer treatment. So it's definitely worth getting the testing.
One of the things that I wanted to mention too is that this is not an easy type of cancer to talk about. People don't want to talk about their rectum or bloody stools or the things that go along with it, So you've obviously overcome that hurdle, but there is a stigma, I'm guessing. It's more difficult to get people to talk about that and have that type of procedure.
Well, there is, because I think it's become more commonplace because, breast cancer awareness used to be that way.
Right.
It used to be that you didn't talk about these things. And I think, they really had an advocacy push that has made it an acceptable topic. And I think we're trying to do the same thing with colon cancer. But yes, I think the more that those of us, especially the ones under 50, share our stories, I think the more prevalent it will be, and the more people will know, oh, this is not just an old man's disease anymore. This is something that could affect me. And it's okay to talk to your doctor about, poop. It's okay to talk to anybody. I mean, it shouldn't be something that is, off the table. So, I hope that it is something that will be discussed, especially with family history, because 5 to 10% of colon cancers, especially in young people, are genetically linked. So if you have a grandparent, or you have, which people don't talk about either, they should say, what kind of cancer do we have in our family? Let's talk about it, whether it's lymphoma or it's, a female cancer, or breast cancer, or colon cancer. We can prevent, colon cancer is almost 100% preventable because you can screen for it. And if you can screen for it and you can find it early, you won't have cancer.
That's
so
what Dr.
it is
Jorgensen was
if,
explaining, that that particular test is not used to find it, to treat it. It's used to find it and prevent it from turning into cancer. So that's a valuable bit of information. I think people get scared they're going to be diagnosed with cancer, and they don't want to know that. Sometimes they just don't want to deal with that reality. But this is a particular screening that is really, truly life-saving.
Yes, and especially people over 50. I mean, you can go in and you can get any of these life-saving screenings done. So there's no excuse for that. And I've been doing my best to encourage people with that too, to say, hey, if you're 50, go in. That's your 50th birthday present to yourself. Because if you have polyps, they can just take them right out. It won't hurt. It doesn't have any long-term effect, and you will prevent cancer. So, it's not only important for the young people to push for tests, but also for the older people that can, receive these diagnostics to get them done.
Well, let's take a quick break, and then we come back. I want to hear more about your specific story and what happened when you were 36 and finally diagnosed properly. We'll come back in just a second.
Get the fastest internet available in North Central Washington by switching to LocalTel and get speeds up to 1,000 meg. Call 888-8888 today or go online to localtel.net.
Hi, we're back. We're talking with Dawn Eicher via Skype. She's in sunny Hawaii. We're talking about her diagnosis of colon cancer that took 16 years from the first time she had symptoms and saw her doctor. Thanks for being here and helping us advocate for screening and advocate for, pushing through when your doctor is thinking that you're too young for this type of cancer. So tell us a little bit about when you got to age 36 and were finally properly diagnosed.
Well, I finally had, I went to my primary care after getting no answers from my OBGYN and saying something still isn't right.
And you were pregnant at the time.
She did. I was pregnant at the time, and it took another 10 months, though, when I started having symptoms while I was pregnant. And I ended up having preterm labor from it, everything, and they still never found it. So I finally went to my primary care physician after it had been 10 months, and she said, let's get you in finally. And she pushed for the colonoscopy. They denied it at first, and she pushed and said, no, she needs to have it. So they still didn't think it would be anything, and they put me off another month before they got me in, because they're like, oh, you're young. It's probably a polyp. It's probably nothing. So, another month goes by, and on April Fool's Day, I went in for a colonoscopy and woke up and they said, you need to see an oncologist right away. You need to see a GI surgeon. Like, we're 99% sure this is cancer. So, trying to comprehend that was pretty devastating. And then within 2 weeks, they scan you, they basically get you set up to have chemo. And I found out I was stage 4. So it had metastasized to my liver. So that's the worst stage possible. And I was pretty lucky that it was still something that we could treat. It wasn't completely, it hadn't taken over my lungs and my liver, which is usually where it spreads. And I was able to treat it really aggressively. I had 30 rounds of radiation with chemo 24/7 for about 8 weeks. And then I decided to do a 6-month round of chemo, the really hardcore chemo, which I thought I was already on that, but it did get worse. So I did do 6 months of, it's called Delox, and it's a combination of drugs together. And then I decided to have surgery.
You've earned your honorary medical degree, it sounds like, and now you're doing well, right? You're doing well.
I am. So I basically told him, you know, I had a 6-month-old. When I was diagnosed, he was 6 months old, my son, and my daughter was 2. And I said, throw the kitchen sink at me because I need to be there for them.
Right.
So we basically treated it as aggressively as possible. And the results were great. I mean, I've been in remission or NED, no evidence of disease, since May of 2014. And I've just been trying to slowly claw my way back to getting stronger and healthier. And, you know, be there for my kids as their mom, as active as I can be, and, you know, advocate and all the things I love to do.
You know, I have such respect for your work. I think that, you know, being a mom, we want to be here for our kids. I had cancer before I had my son, and we weren't sure we could have children. He just turned 18. I've been well for 21 years, and I wish the same for you. Many years.
Thank you so much. I'm really, I feel blessed. I always say I'm the luckiest of the unlucky because, you know, I was chosen for some reason to go through this this trial, and I try to find the silver lining in the storm. And I really do hope that this will lead to bigger and better things and help other people to avoid getting this disease and seeing it ended as soon as possible.
Well, you're certainly the advocate for it. Give me one good resource. Cancer Care Alliance, would you say, for people to go and get more information?
Yeah, the coloncanceralliance.org is really wonderful. They have a lot of resources on there. And then always, you know, the American Cancer Society or the CDC, they all have information about colon cancer and the statistics with young people and what to look for in symptoms. So always good to reach out to someone like that, and always reach out to your doctor if there's ever a question about what's going on with your body. You know your body best. Make sure that you fight for that and get the testing that you need to rule out anything serious.
Well, thanks for being on the show. We made it before your kids came in the door.
Yay!
We made it. All right, thanks so much. Let's stay in touch. Let me know how I can be of help in spreading your word.
Will do. Thank you so much for having me, and thanks for spreading the word about this. I really appreciate it.
Thank you. Have a great rest of your day.
All right. Mahalo.
For all the latest news in North Central Washington, go to ncwlife.com or find us on Facebook. Got a news tip? Email us at news@ncwlife.com or call 888-2020.